Okay, so I'm just going to do a couple of short videos on how to use an oroscope and specifically how to use the WDE Pro oroscope. Now, you can see I've already got this connected to my iPad following the instructions which are on our quick start guide. And when you first switch it on, you'll notice that the camera is facing down, and that will be in the mandibular orientation. So the first thing to do, because we'd always recommend starting with maxillary examination, is rotate it, and you'll see that I'm rotating it in a clockwise direction so that the lens is now pointing upwards. And then we immediately need to flip the screen. So we're going to push and hold the flip button here until we see the image rotate. So now this will be in the correct orientation for maxillary examinations. Okay, and when this pony is sedated with 0.25 and 0.25 of ditormidine and butorphanol, and I've specifically chosen a miniature horse, a very small pony, so that you can see how to safely use the scope in the mouth, even where there's fairly limited space, to really avoid any damage to the tip. It's a very robust design. I've actually dropped one of these on the floor and it's been completely fine. The shaft is very robust, the connection is very robust, the camera housing is very robust. The tip is really the working part. That's the really sensitive part, a bit like any camera lens. This is the sensitive part, and this is the bit you really need to protect while you're working. And my recommendation for how I've always worked is to use one hand as a protector and a guide for the end of the scope. As soon as you leave it loose and it has a chance to move around or be moved by the tongue if there's any chewing, it must not come in contact with teeth. It must not get sandwiched between teeth and instruments, such as perhaps extraction equipment that you may have in the mouth if you're using this for guidance. Be very careful about having this stuck between anything hard and the teeth, because it will shatter and it will break. Now, I've been testing these for 4 years. I've never broken a tip, but I think that's probably because the way that we work is nearly always to use our other hand in the mouth to protect the tip as we're working. So you'll see when I go in the mouth, I always use the technique where I hold the camera in my left hand and I have my right hand sort of above the camera, and it's almost like we're playing snooker. So we'll either move the camera backwards and forwards through the fingers, or actually move the whole hand and then use the fingers to separate the soft tissues and the tongue. And the same for when we rotate the camera into mandibular position. You can use the same way of working, and again use these fingers to separate the tissues, and that means these fingers are always there to protect the lens and make sure that nothing gets happened. If it gets stuck anywhere, it's going to be my fingers that get squashed and not the sensitive and more fragile camera tip. Okay, so we're going to put the speculum on now, and we're going to go in and we're going to have a look around the mouth, and I'm going to show you how easy it is to do an oroscopic examination, also give you a few tips on making sure that the lens and any part of the body doesn't get damaged. Okay, so here we are, we're in our maxillary orientation, and you can see as we come in, the first thing that you should see on the screen as you come in is the rostral aspect of the tooth. If I flip this so that we're in the incorrect orientation, you'll see that it's still the rostral part of the tooth, but as I move to the right, it's just back to front. It's not the correct orientation, because right is left and left is right. So I need to flip that, and now everything's correct. If I move to the left, screen moves to the left side of to the right side of the horse. And if I move my hand across the palate, the screen moves across the palate. So that is the correct orientation. Now just look at the way I'm holding this. So I'm protecting the shaft between my fingers and with my thumb, so it's a nice stable grip, and then we move the whole instrument into the mouth. Now if you're too close to the teeth, you're not going to see anything. You'll be closer than the focal distance, and it'll be difficult to make out individual structures. So the best advice is to almost have the bottom of the shaft touching the opposite teeth. It almost needs to be that far away, then you'll get a much better view. It'll be perfectly in focus. And you should always sort of see a bit of the tooth either side of the tooth that you're examining. Still a bit of food material there. So as we come forwards, we want to make sure that the entire tooth is in the center of the image. If we're too close to the tooth, which will risk damaging the more fragile lens tip, then we're not actually going to see anything on the image. So at no point would you ever need to have the tip of the camera anywhere near the teeth. And as I move back, the tongue is already sort of protruding and is in the way. You see it's actually very relaxed. Pony, as I said, has only had 0.25, but it's very relaxed. But as I move back in the mouth, I'm just going to move the tongue away to give myself space to stay away from the teeth. And as I come back, here we are on the 11, I can move the camera around and I can image both the buccal and the palatal aspects without any problem at all. And then we'll go and do the same on the other side. Now, I don't change hands for left and right when I'm doing an examination. I might when I'm using instruments such as doing restorations, but normally I would just keep the orientation the same and keep the same protection using my fingers and my hand. Now we're going to rotate to look at the bottom teeth. So we're going to rotate to the left. Okay, this is in a anti-clockwise direction. Now we're going to use the rotate button. So I'm going to push and hold the left button, and now we've got a lovely image here of the 4 arcade. I'd normally do the 3 arcade first. And as I'm working now, I'm using these fingers to separate the soft tissues and keeping my hand here, but again, keeping the lens quite a long way away from the teeth. Otherwise, we're going to be too close. We're not going to be able to make out individual teeth. We won't really know where we are, and it probably won't be in focus. So we keep a long way away. You can see my other finger there, moving the tissues away, and now we can see the entire tooth, and we can look around to the lingual aspect, use my other finger on the other side to separate the cheek, look around at the buccal aspect, and then we can work our way back with my hand, keeping the lens well away from the teeth. You can see a little diastema there. You can take a picture of that. It was recording. And here we are back at the 10-11 junction, and again seeing the 11 very clearly. This tip is a long way away from the teeth. So anytime it goes into the mouth, it should be protected by your fingers, and those fingers will also be used for keeping the tissues away. When you're finished, you can just carefully place it down here and rest in a safe position, and then we can pick it up and carry on where we left off. Now we have also made some silicone tip protectors, which you can slide on the end here, and these will fit nice and snugly over the lens to give you a little bit of extra protection, a bit like a bumper case around an iPhone. But having said that, you should not technically need this. You will still get the same image. It doesn't in any way shield the image. We still get exactly the same image quality, but if you have a good safe technique, you shouldn't really need it, but that will give you a little bit of extra security and hopefully avoid any damage to the lens tip. Okay, so I've done some treatment, some basic diastema treatment, a little bit of partial widening, cleaned out that small periodontal pocket. I haven't given any more sedation. You can see the tongue just beginning to be a bit more active. I'm still able to move it out of the way, still keeping my lens tip a long way away from the teeth to give me a nice clear image, and we are done. So hopefully you found that useful, and hopefully by following those simple tips, you'll be able to have many happy hours of using the WDE Pro Oroscope. If you have any questions, queries or comments, do leave them in the comment section below. Otherwise, just click like and subscribe and you'll get notification of any further updates or training videos. Thanks for watching.